Okay, thank you very much. Welcome. Well, I would like to talk about the heart rate. Well, I would like to first of all talk about the history, psychological basis of HRV and HRV measurement, use of HRV in psychiatric research, experimental psychology, clinical samples, non-clinical samples. I'm going to be mentioning about that, and finally I'm going to be talking about 1.0 heart rate velocity. When we look at the history, the heart rate is not stable. It shows variability. It is known since the ancient times. When we come to 18th century, 19th century, the local dissection research carried out on live animals gives room for observation, and the first publications emerge in 1895. EKG is developed, and the observations increase. In the 1960s, 70s, 80s, actually, the predictor studies are carried out, and later on, the physical psychological studies are carried out. So what is heart rate variability? It's depending on the changing emotional needs, how much does heart rate differ? This is a parameter as such. Well, there is the train that you see and the car. As you may assume, the route of the train is straight, In the railway, on the railway, there isn't turns. So the mechanist, as long as it doesn't do an extra maneuver, the speed actually is relatively stable. So what about the cars? No, in the route, because there are ups and downs, bumps, and there is traffic, so it has to slow down or else it sometimes take over. So these two vehicles, even though they finish the park at the same time, or else their average speed, even though it is totally the same, when we observe speeds based on time, we see that there is a difference. Automobile is here indicated in red because so if is a train stable pattern more associated with life itself, or else the car speed? Well, the course of life is not straight, so the life conditions change all the time. So a different, actually, automobile-like speed is more adherent to our daily lives. So in terms of psychopharmacology, there is actually two parameters, the sympathetic and parasympathetic interventions of the autonomic system, their impact on cardiac activity, and this autonomic nervous system. It's being regulated by this central autonomic network, limbic system, and cortical system. I'm talking about a complicated system here. So all these structures here, the peripheric structures, autonomic structures, of course, they are not one way, and they are complicated actually. They function in a complicated reaction. So sympathetic and parasympathetic intervention, the nerve ending, how does it actually reach the heart? You see a figure here as such. As you all know, endogen rate is the synaptic node. It is impacted. So the brain, over the synaptic node, there is the gas and brake system. So the brain presses on them, like parasympathetic system, vagus, on the brake, and gas is also functioned by another system. So with postganglion synaptic transmission mechanisms, we will look at them. In the sympathetic system, over beta 1 and beta 2 receptors, it influences them, and vagus impacts over muscarine 2 receptors. So these two signal mechanisms, in terms of temporal profile, they are different. For that reason, their effect onset and their ending is significantly different from each other, just like the gas and brake on the car. So it is 4 seconds in the sympathetic, and for parasympathetic it is 0.5 seconds. And in 1 second it can be withdrawn from the system. So when we talk about the measurement of HRV, how does it measured? There isn't actually a overall measurement. There are statistical and mathematical methods actually, and there are certain parameters. It's an umbrella concept, but mostly there are 2 categories which are used. The first is the time domain measurements, and the other one is the frequency domain measurements. And here we are going to be talking about frequency domain measurements, and each day new methodologies are developed. And here the frequency domain HRV measurements, there is this graphic as such. This is the power spectrum density. Here the variance, so how does it is distributed? The one that you see in green is very low frequency band. It is like 0.0 between 0 to 0.0 hertz heart rate, and the one that is indicated in red, it is the low frequency HRV waves. It is between 0.04 to 0.15 hertz, and high frequency is between 0.15 to 0.4 hertz. So every 2.5 seconds actually it is high frequency. So this they are in this band, high frequency band. We have mentioned before, only in the parasympathetic system actually there is this potential. So in the high frequency band, the parasympathetic influences, others are more heterogeneous and they are more complicated. Okay, so why do we explain all these? What is the connection with psychological processes? In the psychiatry research, in the experimental trials, how can we use this? How can we benefit from this? Well, roughly speaking, the central nerve system, or as in the brain actually, there are changing situational needs, and there is an adaptive emotional response that is developed. And then this emotional that is created, actively it is regulated, and emotion regulation capacity is the definition of this. And this emotional response creation, and while it is created, all sorts of physiological stimulant outcome is concurrently transmitted to autonomous nerve system, and over that sympathetic and parasympathetic interventions do transmit to peripheric structures. This is the sinoatrial node. And high emotional regulation capacity, in general, it is benefits from a flexible autonomous system, and this increases the HRV. So why have I put these pictures in the storm? Because you see the trees which are bending, they do not resist to the wind, but they do not also, they are not damaged, they survive actually. This is how a healthy autonomous system should be like. If there is low emotional capacity system, if the organism based on emotional if it cannot develop emotional responses, or else if it cannot actively control the responses generated on the autonomous system, this creates a rigid impact. So this leads to low heart rate variance, which actually resist to changes, which creates psychopathologies. So now let's have a look at the psychiatric research. There are two classes. The first is studies on clinical samples, and the other one is the non-clinical samples. The clinic samples, there is a future to it. They depend on long EKG records, and they have psychiatric diagnosis, the sample, and it is on without a chemical intervention. Directly the autonomous nervous system information is received in the study. So I'm going to be mentioning them really quickly. First of all, with comorbid depression diagnosed coronary artery patients, the heart rate variance compared to the non-depression group, it is significantly low. Low HRV, actually, in the coronary artery disease patients, it is directly correlated with mortality and morbidity. And mourning or as melancholic depressive patients, the HRV decreases. And here, interestingly, the depressive symptoms, as they improve, the major depression patients, the more they receive treatment, the HRV increases. So this is not fate. The symptoms, as they improve, the autonomic nervous system flexibility increases. And panic disorders, unique phobia, or else with anxiety, in general, HRV decreases. With bipolar depression, this is also the same. And in the manic episode, the bipolar patients, HRV decreases significantly, but interestingly, this correlates with the symptom severity, so autonomic dysregulation. Actually, rather than the neurological structure of the patient, it is to do with the episode of the disease, illness. And you see post-trauma syndrome and bipolar, for instance, when compared with the healthy group, the HRV significantly decreases. So here, we see the second category studies. Here, the records are shorter, and HRV here they show how it shapes in regard to an intervention. For instance, with primary school kids, a research was carried out. When they show a sad movie, some children are more anxious actually, and some social capabilities with some children are higher, and this actually is directly related with the HRV, and there are many studies in this respect. And university student study indicate that emotion regulation capacity, if it is high, or else with the adaptive coping strategy, if they use it more frequently, HRV is higher. So the final research was about fears and angst. Once they are shown negative scenes, like reinterpretation, distancing, reframing, for instance, these techniques, if they use it, suppression emotional responses, or as distraction, for instance, compared to maladaptive strategies, there is a significant increase in HRV. And there are studies about the impact of alcohol on emotion regulation. A group intakes alcohol before the trial and after the trial, and there are affective visual stimulants which have been shown, and the ones who consume alcohol, the HRV significantly is suppressed. So alcohols, there is a belief that it increases emotional regulation, but now we see that that is not the fact. And a high-level neurotic patients and their segregation control. Again, negative stimulants were shown to participants. The free looking technique, directly looking, or else reinterpretation technique was requested from them. The individuals with high neurotic features, both in free and cognitive techniques, compared to the control group, the HRV significantly decreases. So, in terms of psychopathology, the risky patients, in terms of regulating emotions, they are not sufficient. And finally, I would like to talk about a preliminary piece study with automatic, without spending any effort, this natural emotion regulation and cognitively strengthened emotion regulation technique. We wanted to compare it. Our sample was the medical faculty students, and during the trial, without spending any effort, the control group here and the cognitive distancing group, two groups there were, and the visual task, that was the structure in the basic group. There were different visuals which were shown, and then after 30 seconds natural block starts, and students studying at the library, people working out on the streets, and umbrella, non-emotional stimulant visuals were shown. And in the final block, as you see, attack, injury, and negative emotional stimulants, IEPS visuals were shown, stimulants were shown. This was our trial environment, yes. So the recording was completed, the HRV data and the stimulant blocks were matched on time base. So here, 0.1 Hertz band, that in the frequency analysis, 0.1 Hertz band, I would like to draw your attention to that. In the, when we show geometrical visuals, this value, it is 200 seconds milli square, and in natural visual there wasn't much of a difference. In the negative block, there are emotional, negative emotional stimulants, there was an emotional response created, an automotive or else cognitive. An emotion regulation effort emerged, and 0.1 Hertz of dramatic HRV increase was observed, which means that emotional regulation in the acute, even in the acute period, if you got a specific parameter, you can detect its impact on HRV. So now, let's come to more striking results, control and technique groups. In both groups, even if you look at it free or else cognitive distancing technique, the negative stimulants, if once they are shown compared to neutral, there is a significant increase in both groups. However, in the technique group, the increase compared to the control is more striking, and statistically it is more meaningful. It is more dramatic, which means that, yes, cognitive technique implementation, it increases emotion regulation efficacy, and this is 0.1 Hertz compared to that parameter. It can be detected objectively. So, as a conclusion, HRV is a non-invasive and objective index of the brain's ability to organize regulated emotional response through the ANS, and can be used as a marker of individual difference in emotion regulatory capacity. HRV provides information regarding both PNS and SNS activity. Therefore, reflects both inhibitory and excitatory processes in emotion regulation. And HRV parameters is more used in this respect. There are many publications increasing that respect, and HRV is a promising tool for the understanding of complex psychological processes during the emotional regulation. Thank you very much.